Hi, I'm Dr. Marta Baird. In this video, I'll be explaining interproximal reduction, or IPR, as we use it during orthodontic treatment. When teeth are in full alignment and fit correctly within an arch, they occupy an arch perimeter. Whether through growth or maturation, there is a constant progression of the back teeth coming forward over time. This is a common cause for crowding during childhood development, but also in adults as teeth mature. The lower teeth do not move forward because the upper teeth and lower lip limit their forward movement. If the goal is not to push the lower teeth forward, we need to create space to align these teeth. Interproximal reduction involves the removal of a small amount of enamel from between the teeth. This is a 3D model of a patient who would benefit from orthodontic treatment. She has moderate lower crowding, and the simulation shows the teeth could be aligned by allowing her lower teeth to come forward. However, by integrating the 3D X-ray with this model, we can visualize the position of the roots as well as the bone which supports the teeth. We can see that this type of movement would cause her lower teeth to move out of her jawbone, which could cause future dental health issues. Instead, this patient was treatment planned to have interproximal reduction. By conservatively performing this procedure over several teeth, you can see that this patient can have alignment without the lower teeth needing to come forward. Without this 3D model, we wouldn't have seen how this procedure could improve our patient's long-term dental health. Sometimes we use interproximal reduction for the correction of dark gingival voids. When crowded teeth are aligned for some adult patients, in between the teeth, the gum tissue does not fill that space. It's because adults are no longer growing. These dark areas are called dark gingival voids. To improve their appearance, sometimes we contour the sides of the teeth in order to bring those teeth in more closely. We take about 0.2 to 0.3 from the surfaces of those teeth to reduce the size of those dark gingival voids. Here's an example of a patient that had a space between her two front teeth. She wanted to improve the appearance. So, we used interproximal reduction to shape the surfaces of the teeth between the teeth and then brought those teeth closer together. This is another example of a patient that had some mild crowding and protrusion of her teeth. After orthodontic treatment, her teeth were aligned and the appearance of those dark gingival voids improved. However, this patient wanted to seek cosmetic treatment to enhance her smile. Here's the patient before and after orthodontic treatment. And here is her before and after cosmetic restorative treatment. This was an optional part for her, but she really enjoyed the improvement in her smile. There have been many studies over the years as orthodontists have been concerned about the safety of interproximal reduction. Interproximal reduction has been found to be safe, a conservative way of gaining space with no increase in tooth decay or sensitivity, while at the same time it improves oral health by increasing the ability to floss properly in areas where teeth were overlapped without creating those dark gingival voids where food might get trapped. How is interproximal reduction performed? Well, here's a video of me performing interproximal reduction on one of my patients. I use a very fine file that's about the thickness of a piece of paper, and I gradually polish in between each tooth. Thank you for watching this video. For more information on orthodontic treatment, visit BairdOrthodontics.com.